This skit will be acting out a person-centered therapy session. The main character in this skit is depressed because her best friend died and she believes that it is her fault. The therapist is already aware of the situation, and despite her reluctancy to go to therapy, she is here because her parents want her to be here.
Hi, I'm here to see Mr. Lopez.
Mr. Lopez, you have a patient. Mr. Lopez is ready to see you now.
Okay, thank you. Hi.
Hello, sir. I'm D'Angelo.
Hi.
Please take a seat.
Fine.
What's been going on lately?
Nothing much, just the usual.
I get the feeling that you don't want to be here right now. Am I right?
Yeah, this kind of isn't really my thing. I'm kind of just here because it's what my family wants me to do.
How is your family? Have they been helping you with the healing process?
Yeah, I guess. I mean, I moved back home after Rachel's death, so I've been there ever since.
And is it different living with them rather than Rachel?
Well, I mean, yeah, of course. She's my best friend. She's my roommate, and now she's just...
Gone?
Exactly. She's gone.
How does Rachel being gone make you feel?
Well, bad. Obviously, it's my fault.
How is it your fault?
How is it not my fault? She called the house asking for a ride at like 2 a.m. and I told her that I was too tired. I asked if she could find a different ride. She said yeah, but she ended up walking home instead, and then she got hit by the car.
If you knew that she did not have a ride, would you have given her one?
Well, yeah, but
But what?
I just feel so guilty all the time.
How are you coping with that guilt?
I don't know. I just find different ways to pass time, I guess.
How do you forget?
Well, I have some drinks here and there. Sometimes if I'm feeling a little risky, I'll take some pills.
What kind of pills?
I'm not really sure what they're called. It's like Norbamine or something. I don't know. My friend gets them prescribed to her.
She just give those to you?
Well, yeah. I mean, I guess sometimes we mix them in our drink. We just find different things to do
And did you meet these friends before or after the accident?
after.
And what do you guys usually do?
We just hang out. We just find different ways to pass time.
Like drugs and alcohol?
Exactly.
Do you have younger siblings?
Yeah. Why?
How old are they?
My little sister's 15 and my little brother's 5.
Are you close with them?
I mean, I guess. I mean, I'm their sibling, so as close as that gets you.
Do they look up to you?
Oh, I don't know if I would go that far. I don't know. I mean, I am their older sister, but to be honest, I do not know.
Have they ever seen you intoxicated or high?
No, I don't think so. Maybe, I don't know. I think I do a pretty good job at hiding it, so.
Now I have a note here from your mother. She told me that she knows of your pill taking and your excessive drinking. She said that things were getting out of control, that you drink from the minute you wake up until you go to sleep at night. Is that true?
Yeah, what's the problem?
She mentioned that your little brother wanted to have some of what you were drinking. That he wanted to be happy like you.
What? No, she never told me anything like that.
You look upset.
I mean, yeah, I'm upset. He's only 5 years old.
You're right. He is only 5. How do you feel about your brother wanting to be happy as you?
I don't want him to be happy like me. I'm not even happy. This is not how a person should live. I have guilt. I take guilt and I have it on me all the time, and I don't know, I just constantly think about Rachel's death, and I don't even know how to explain it. I just don't want to live like this anymore.
So what do you think you should do?
I've been thinking, the only thing I can think about is rehab, and it just scares me to death. I mean, I don't want to disappoint my family, and I really don't know. I don't know what I should do.
How are you going to help yourself get better?
I don't know. I think I do need to go to rehab. I think it's the only way to get rid of Rachel's guilt. It's the only way to stop drinking and stop doing drugs.
anything else you can do to make yourself feel better?
I mean, I guess going to these, like talking to you, I guess, because I don't really have that many people to talk to, so maybe if like we could continue this like during therapy, or I mean during rehab or after rehab, or I don't know.
It is your decision. What do you want to do?
I want help. I need help. I need to get rid of my guilt for Rachel, and I need to stop with the drinking and the drugs.
Okay, that is a very good decision. That is the end of this session. I would look forward to meeting you again.
Bye, Mr. Lopez. Thank you.
Okay.
Person-centered therapy is when the therapist guides the patient in the right direction. Instead of telling the person what to do, the patient decides on their own that they are ready and they are in need of help, instead of the therapist forcing it upon them.